with that, let's open it up for some questions. Over to you, Kevin.
Thanks, Jeff. We have time for a few questions today. First, let's go to Sabrina Siddiqui at the Wall Street Journal.
Thank you, as always, for doing the briefing. As you consult with experts on transitioning to the next phase of COVID, are there specific benchmarks that you're looking at? Is it still transmission, or is there a certain rate that you want to hit with respect to hospitalizations and deaths in order to be able to loosen certain restrictions? And then this is perhaps a question for Dr. Walensky, but is there any talk of issuing guidance on test to stay for daycares and childcare centers? That's something some parents have pushed for, because right now a lot of daycare is shut down with simply one positive case, or they don't let children who even present any symptoms, they don't let them attend even unless they have a negative PCR. So is that something that you've looked at, a test to stay for daycare and childcare centers?
Dr. Walensky, you want to talk about daycare centers first?
Yeah, sure. So our test to stay data that we have is largely, the science around it is largely in settings where people are masked, which is why our test to stay strategies now both use masks but also using 2 tests a day. In our early childcare guidance that was put out, though, we do have some flexibility in there, recognizing the challenges associated with children who can't wear masks and in these settings, and actually do offer some flexibility for returning to those settings in during certain situations.
So as to our planning process, I want to be very clear that our highest first priority is fighting Omicron. As Dr. Walensky said, cases and hospitalizations are coming down but are still at elevated levels. At the same time, we are preparing for the future. We've been clear that as a country, we're making strong progress toward moving to a time when COVID is no longer a crisis. We are actively reaching out to healthcare, public healthcare experts across inside and outside of government to get their input. We're working very closely with state and local leaders, including governors and business leaders. And as Dr. Walensky said earlier, the CDC is looking at all of its guidance, including mask guidance, in light of declining cases and hospitalizations. So we are running a very thorough, deliberate process, and we will get this right. Next question, please.
Go to Tommy Christopher.
Hi, yes, thank you again for the briefing. My question is, I know that there's been a lot of media pressure because some states with Democratic governors have eased mask mandates, but it's my understanding that a lot of these changes are gradual. So could you talk about the timelines for some of these state rules as you understand them and how they could coincide with the CDC's deliberations?
Dr. Walensky?
Absolutely. So maybe just to say, many of these state-based policies have come out in phased approaches, that they are talking about, something that might happen in a week or two, masks that might come off in a week or two at the end of February, early March. And so, of course, our metrics are going to examine, as Jeff said, and as I previously said, issues related to cases, certainly issues related to severity of disease and hospital capacity. And we anticipate that many of these will intersect in terms of timing.
Next question, please.
Zeke Miller, AP.
Thanks for this. Jeff, you mentioned that among the people the White House has been talking to are business leaders and other folks who aren't scientists. Does that indicate that this sort of move to the next phase is not just a scientific decision? It's sort of balanced by sort of economic concerns and other and other prerogatives, not just health, sort of strictly health and safety on one side. And second, in terms of that timeline, what should we expect that rollout to look like? Will it be individual pieces of guidance from CDC if that time in place comes, or a major speech from the president? And how does the administration view its responsibility to get people who right now maybe want to wear masks and sort of convince them that the science will allow them to take it off when that is the CDC guidance?
Okay, a lot there. Zeke, I want to be clear that everything is driven by science and public health. Obviously, it's important to understand the perspectives of different constituencies, including for businesses, how they think through bringing workers back to work, as an example. But public health, science, medicine is the center of the work here. In terms of masking, obviously individuals, and I'll turn to you, Dr. Walensky, under any situation may choose to wear a mask, a high-quality mask, and that's a good thing and a matter of personal choice. Dr. Walensky?
Yeah, and I want to sort of indicate, as I mentioned earlier, there are times where we do want people to continue to wear a mask if they are in the 10 days after they've been diagnosed with COVID. They're feeling better, but we want to make sure that they know that they should be masking during those last several days when they might continue to be infectious. So there are clear times when we want people to continue to wear a mask. And I think as we have fewer and fewer cases, people will become more comfortable with taking off their mask. But as Jeff noted, we certainly want people to have the flexibility to wear one if they so choose.
And then in terms of timing, as I said, we're running a very thorough, inclusive process, the science and the medicine at the center. We're moving deliberately. At the same time, I think we will have more to say on this across the coming weeks. Next question, please.
Ann Flaherty, ABC.
Hey, thanks for taking my question. So just to clarify on one point, and then a question for Jeff. Dr. Walensky, you said you did plan to update the guidance soon. I want to clarify that is indoor masking, and if you can say that might come as early as next week. And then Jeff, if you could say, has anyone within the administration indicated to the CDC at all that they would like to see revised mask guidance by the end of the month? Thank you.
Maybe I'll start and just say we are looking at an overview of much of our guidance, and masking in all settings will be a part of that.
And I would just say that CDC is clearly in the lead here on both the substance and the timing of masking guidance. Next question, please.
Josh Wingrove, Bloomberg.
Hi there, thank you. I'm wondering if Dr. Inglesby can give us an update on the at-home testing program, in particular any metrics around how many orders have been placed, how many tests have been shipped, how many tests you have on hand, and more broadly, Jeff, I'm wondering if you can speak to Secretary Blinken's remarks earlier this week regarding the president's goal of vaccinating the world. What more do you think you need, in particular in a supplemental from Congress, for instance, to be able to get more shots into arms globally to hit the president's 70% goal by September, or come closer to it? Thank you.
Good. Okay, let me take a response first to the question about the covidtests.gov and the at-home test ordering. Today's an important day, actually, in that we hit a milestone, 50 million shipped orders to households across all states, tribes, and territories. That's a total of 200 million individual tests shipped to Americans across the country. So 85% of the initial orders are now out the door. And in the next several days, we will complete the shipping of all of the initial orders. I want to emphasize the Postal Service is doing really an outstanding job here. Once a package ships, over 60% are delivered within 24 hours and 90% within 48 hours. So they are packing and shipping incredibly quickly and efficiently. This is an effort that has no precedent. There's been incredibly strong demand and incredibly strong execution, shipping 200 million tests directly to Americans' doorsteps. Really a very strong performance across the board. In terms of continuing to make progress on global vaccinations, America is clearly leading the world. We've committed 1.2 billion doses to the world, free, no strings attached. We've already shipped well over 400 million to 112 different countries. Each day, millions of doses get shipped. The emphasis is on continuing to supply those 1.2 billion doses, and at the same time to help countries get shots in arms. And that's an effort that USAID and the State Department are taking the lead on. along with CDC, to help build confidence in other countries, to create better access, to set up mobile clinics, and that becomes the effort going forward that becomes most important, is taking vaccines and turning them into vaccinations. Next question, please.
Let's go to Joyce Frieden at MedPage Today.
Hi, yeah, thanks for taking my question. I guess this is for Mr. Inglesby. I'm curious about your efforts in expanding at-home testing. I think people are still seeing that if they want to buy a test, the prices are pretty high. Is anything being done in terms of trying to get the prices down?
Sure, yeah. And so I think, as you know, on January 15th, the administration required private insurers to cover the full cost of over-the-counter tests. So that's 150 million Americans covered by private insurance can now go to a pharmacy or to an online retailer and get over-the-counter tests fully covered. About 50 to 60 million people are now covered by insurers where you can do that directly at the cash register with your insurance card. And we're working with insurers to encourage them to create those point-of-sale options. Medicaid covers these tests. Medicare will cover these tests by spring. So we're moving in the direction where these tests should be completely covered for Americans, and they are now for many Americans.
I'd add to Tom's statement that, we've also, in addition to the 200 million we've already shipped free to Americans' doorsteps, we've secured $1 billion in total. So there's another 800 million tests that are either contracted for or in the process of being contracted for that'll be available free to the American people. And there are also 20,000 free testing sites across the U.S. Where people can get tested for free at local pharmacies and other convenient locations, including community health centers. So plenty of options on free testing across the country. Next question, please.
A couple of more questions. Let's go to Jacqueline Howard at CNN.
Thank you for taking my question. Dr. Inglesby, you mentioned here on CNN this morning that the government will be making high quality masks available for kids, and that process is underway. Can you share more details on how is that going to work, and when might families get to have these masks in hand? Thank you.
Tom, go ahead. Dr. Inglesby, sorry.
So as you know, that already 230 million masks have been delivered to pharmacies and community health centers as part of the administration's effort to deliver high quality masks around the country. And that process will continue. We are now in the process of planning for the distribution of masks for children, and we'll have more to say about that in the days ahead. But there's a commitment to do that, and there's a process underway certainly for all adults to get masks now for free at pharmacies and community health clinics across the country.
Next question, please.
Last question. Let's go to Meg Tyrell at CNBC.
Well, thanks. Just thinking about a potential transition to thinking about gauging the pandemic by its effects on hospitals and severe disease, how should people take into account the risk of long COVID as they're considering whether to keep masks on? As we hear, it could be affecting, 10 to 30% of people who get COVID, no matter the severity of their case.
Fauci?
Well, certainly long COVID is something that we take very seriously. We know we're studying it really quite intensively now over the last year. We know that you don't necessarily have to be hospitalized to get long COVID, that it ranges from people who are mildly to moderately symptomatic to individuals who are actually requiring hospitalization. There are a number of factors that seem to be associated in recent studies with long COVID, ranging from things like type 2 diabetes to viral load to reactivation of CMV, of EBV, as well as things like autoantibodies. We don't really understand very much, but we're learning literally on a week-by-week, month-by-month basis. But in direct answer to your question, Meg, you certainly want to protect against all infection. We'd like to do that. We certainly want to protect against symptomatic infection. We'd like to do that. And we don't take lightly long COVID. So that has to be put into the equation of what our ultimate goals are. But clearly the thing that is the most important is keeping people out of the hospitals for the most of the reasons that I think Dr. Walensky explained very, very clearly, that not only relate to the person with COVID-19, but the impact that it has on the rest of society outside of the context of COVID. Thanks.
Well, thank you, everybody. We look forward to the next briefing.